Okay. Hi, everyone, and welcome to the event, our Senior Center Without Walls series funded by the United Way. I think everybody knows me. I'm Lori Stamen, manager of the Seniors Resource Center here in Metchosin. May is Speech and Hearing Awareness Month, and we've invited Dr. Lisa Lopez. She's an audiologist and owner of Ocean Audiology in Langford to talk about and answer your questions on common hearing issues. But before we begin, I just wanted to go over a few housekeeping items to let everybody know the event will be recorded and posted on our Metchosin Seniors YouTube channel. You can unmute yourselves if you have a question for Dr. Lopez, or you can type it in the chat and I'll read it to you. And with that, I'm going to turn the mic over to Dr. Lopez. Welcome.
Thank you. Thank you for having me. So this is my first Zoom presentation. So let's see how it goes. I'm informed that if I turn my head, you can't hear me. So just yell at me. How's that? Anyway, I'm Lisa. I have a doctorate in audiology and a specialty in vestibular disorders, which is any kind of dizzy symptoms. I also have an interest in animal audiology. So clearly I have too much time on my hands, I think. But anyways, I'd like to test puppies' hearing is what I'd like to do. I own Ocean Audiology. It's in Langford. It's an office by appointment. Yes, Norm? Oh, we're by appointment only because I'm often off-site. So what we're going to talk about today, a few things. I've been an audiologist now for about 26 years. So I'm going to run through the common questions or comments that patients will say to me when they come in for a hearing test. So we're going to review that. When you come in for a hearing test, you sometimes need actually to go see a medical doctor. So I'll run through some of the red flags for that. A really important topic is the impact of hearing loss on overall health. So we're going to review that today. And then my favorite is hearing aid technology, because there's some really cool stuff out there and some advances, both in the hearing aid technology as well as ways that we can fit you, ways that we can test you. And then we're going to talk about funding and overall cost of hearing aids. So I have one question for all of you. Can you all hear me well? Okay, good. Okay. Okay, so the most common comment that people say when they come in to get their hearing tested is they can hear, but they can't understand. So I'm just going to explain that to you. When we test hearing, there's lows, mids, and high frequencies. Speech is across the board. A very common type of hearing loss that happens as we age is called presbycusis. And that's specifically in the high frequencies. In the high frequencies are the consonant sounds, the F, S, TH. So if somebody says fat, sat, or cat, you can kind of miss that. So while you hear well, like you hear what's being said, you can't quite interpret it. And that's the most common concern or question that people have. And that is the reason. Another common question when you get your hearing tested is, can I get away with one hearing aid? The answer is no. If you have a hearing loss in 2 years, you need 2 hearing aids. The way our brain processes information, it needs help from both sides in order to interpret it, comprehend it. Obviously, you'll get better sound quality that way as well. And it does help with vocalization. Anybody here have ringing in their ears? Okay, that's another, that one does, okay, Art. So ringing in the ears is called tinnitus, and it's very, very common. It's a symptom though of something. It can be a symptom of high blood pressure. It can be a symptom of, you know what, even earwax. So the important thing is tinnitus is typically associated with the ear, but not always. So it has to be taken seriously. If you have tinnitus or ringing in your ears only on one side, that's very important to get looked at because it's not typical. So it has to be investigated. A rare type of tinnitus is called pulsatile. So it's when you get this whooshing or clicking sound that kind of mimics your heartbeat. Not as common, but very important to look into it because it's more likely that there's a reason for it that we can trace back. So you should see your doctor about pulsatile tinnitus. It could be abnormal blood vessels, high blood pressure, or ear-related as well. Okay, too much wax in the ears. For this, you can feel plugged up, you can be in pain, and of course you can have difficulty hearing. So you should have your ears checked for that. And on that note, there's clinics, private practice clinics that will clean your ears, cerumen management. It's a certification for audiologists in BC, and it's a chargeable service. Or you can go to your MD and they will take it out for you, okay? If you have hearing aids, I don't know if anybody has hearing aids here, but you need to see your hearing healthcare professional regularly because when you have hearing aids, you're actually blocking off the ear canal. And so you're gonna collect wax more. And so it should be looked at for proper functioning of the hearing aid. Okay, here's a good one. Why are hearing aids so expensive? Well, common question. A lot of research and development goes into hearing aids. They're computers. And what we want to do is replicate a normal auditory system into a very small computer chip. So there is a lot of research that goes into it. Some of the advances in technology are focused on how to, for instance, if you're in a loud room, a restaurant, you want that speech to jump out at you in the midst of all the noise. So the technology in hearing aids attempts to reduce the background noise with directional mics, noise cancellation, all these devices, and that's where the bulk of the research and development goes to. Essentially, they're computers. So there are hearing aids that you can purchase online, over-the-counter hearing aids. And I'm sure that you have heard of them or have seen them, like a $99 hearing aid. So I'm gonna touch on that a bit. Guess what I did? I added a couple of slides that I shouldn't have. Anyway, touching on online hearing aids, okay? You might be sacrificing performance when you do that. So you'll see advertisement for $100 hearing aids all the way to $3,000, $4,000 hearing aids. And so there's a big range. Some of them are generic, made by not hearing aid manufacturers. So it could be a microphone or receiver. So you really got to be careful what you're getting. Oftentimes, when you go to purchase a hearing aid online, they'll ask you to send in your test results and they'll program it for you, and then you get that device. The problem with that is there are many types of hearing aids. And a hearing aid has a receiver, which is this wire, and a dome that sits on the end. That's what you're going to get in the mail. But the problem is it has to be fit precisely on your ear. The tube, I'm moving away. Can you hear me, Lori? I'm still okay? Okay. The tube should not be too long, otherwise it's going to fall out. The dome has to fit. The dome has to fit for power, because if you have a lot of power coming out of this hearing aid and you just put a simple dome on there, you can get feedback, which is whistling. And that's terrible. You're never going to wear it that way. Really important thing that a lot of people don't know is if the hearing aid's not precisely fit at the top, your microphones are off. So your directional mic capability, your ability to hear in background noise goes right out the window because the microphone's sitting too far down. So those are some of the reasons to stay away from online purchases. Another point is that when you're fit with a hearing aid, there's something called verification. A tube is put down your ear canal. It sits about 2 millimeters from your drum, and we measure the sound pressure level of soft, average, and loud sounds, so we know exactly what you're getting. So your hearing aid is precisely fit. You can't get that online. So online hearing aid sales are some of the reasons that some people are unhappy with hearing aids. So just buyer beware. Okay. So here's another question. Free hearing tests. Why some clinics offer free hearing tests and some of them are chargeable. So a couple of reasons. There are free tests at many places in the city, many places in BC actually. Often if it's a way to attract clients to come in, which isn't necessarily a bad thing because our entire goal is healthy hearing and to make sure that if you have a hearing loss, it's being addressed. So you can get a free hearing test. You need to know the difference between a screening and a test. A screening is just a basic, do you have a hearing loss or not? A full audiological evaluation will assess, well, first of all, we look into your ear and we can assess the ear canal, the eardrum. We can see any abnormalities just by looking in. We have a machine that puts a little bit of pressure against the middle ear, tests its mobility, so we can tell if there's any stiffness or if it's abnormally moving around too much. And then the actual organ of hearing, which is the cochlea that sits back here, that's when the testing can differentiate if there's a problem in the middle ear system or the inner ear. So you really want to assess that, and sometimes you're going to have a chargeable service. So just ask those questions. Another question you could ask is if you're thinking, you know what, I want to get my hearing tested because I think I need hearing aids, ask your service provider if it's included in the cost of the hearing aids, because sometimes they'll just bundle it in for you. Okay. Okay, so impact of hearing loss on overall health. Basically, if you don't use it, you lose it. When we're not hearing well, we disengage. So the number one negative, I would say the number one personal negative aspect of hearing loss is untreated hearing loss, is people just don't bother trying anymore. They know that they can't hear anyway, so they just kind of sit back and let the crowd carry on. And it's really disheartening. The impact of COVID-19 as well on people with hearing loss just made things so much worse. Can you imagine? You can't hear in the first place, and now you have a mask on covering the very thing that helps all of us, which is facial and our lips. So communication isolation. And to be honest, the auditory system and the brain work hand in hand. Your ears pick up the sound, but it's your brain that processes it. And if there's a disconnect there, your brain just has to work overtime to try to figure out what's going on. On that note, when you're spending so much energy just trying to hear, your brain doesn't have energy for other things like cognition, memory, and that's where dementia comes in. That's where other health concerns come in, simply because it's working overtime. And it negatively impacts you, and you get tired. When you can't hear well and you're out and about and you tried so hard just to catch up or hear or wherever you are, you're exhausted by the time you go home. So there's a lot of reasons. Hidden risk factors, your brain atrophy. We talked about social isolation that can lead to dementia. And then, and by the way, when I mentioned the link between hearing loss and balance, I sent Lori a couple of handouts. That the handouts are hearing loss and balance, hearing loss and risk of falls, and cerumen management. So if you want any of those handouts that I have from the office, she has a copy of them and she can email you that. So balance is one of the jobs of our ears. It's again, when I talk about the brain having to spend so much energy on one part, which is hearing, it can impact because it's not keeping you balanced and upright. Because essentially we need to be focused, and walking is just an automatic process, but your brain is expending too much energy other places, and it increases the risks of falls. So it's important to understand that hearing loss is more than just communication. A couple of interesting facts. Even a mild hearing loss triples the risks of a fall. For every 10 dB of hearing loss, your risk of falling increases by 140%. So that's huge. And again, more brain power on hearing, less resources on walking. Okay, so should you go see an audiologist or a hearing healthcare professional or a doctor? Depends what's going on. If you have active discharge from your ear, I need to know what kind of discharge it is, but if it's foul smelling, get to the doctor because it's probably an ear infection and you probably need some medication. If you have pain in your ear, you know what? It could be wax, and your audiologist can look in and tell. If you use Q-tips and you push the wax too far down, so long and short, don't use Q-tips because they're not meant for the ears. So anyway, if you have pain, it's debatable what kind of pain. If you have sudden hearing loss, go see your doctor. They can reverse that with medication. So that's another red flag. Take that very seriously because you could stop a permanent loss. Dizziness. Typically, you'll probably end up to having to see your hearing health care professional because they need a thorough assessment to figure out why you're dizzy. Fullness in the ear, depends what kind of fullness, but I would see an audiologist in that case. And then wax, well, you can't see it, but that's why you come in and we'll check it out for you. Okay, so common signs of hearing loss. I think you guys already know all this, but I'm going to tell you anyway. You talk loud, and you're probably thinking, good thing I have a speaker on, or good thing I have a volume control on your computer, because I talk so loud, and it's because of my clientele, and I can't sometimes bring it down. And so then when a client's in my office, I literally just stop and say, I'm yelling at you, aren't I? So anyways, coupled with the fact I have a hearing loss. So anyway, you speak louder than others, that's one thing. You ask to repeat, you strain, you misunderstand what's being said, you think people are mumbling, and they're often not mumbling. And you turn the TV up, you have problems hearing on the phone. Again, you withdraw, things like that, or ringing in the ears. Okay, there's not a whole lot of funding. We're going to talk about funding for hearing aids. BC doesn't have a lot of help. I guess the Ministry of Social Development, I'm new to BC, but the ministry helps with low income. On their website, I checked it out. It does say only children, but I did ask a couple of audiologists that I work with here in BC, and then apparently it helps adults too. So I can follow up on that just to check. Every province is different. I moved from Alberta. They gave $900 towards the purchase price of hearing aids for everybody over the age 65. So depending on the province, but I know BC, there's little funding. If you're interested in hearing aids, ask your provider if they will, there's payment plans. And do you know what? There's different types of hearing aids. There's different styles. There's different levels of technology. So that doesn't always have to be the high end. So, okay, so some cool, my favorite topic is hearing aids. So first of all, does anybody have any questions?
Well, I have a lot of questions, but I'll wait till you're done your presentation. Yeah. We'll get into the cool stuff.
Okay.
First.
Hearing aids have really advanced. Long gone are the days of batteries, for instance, because they're all rechargeable now. I shouldn't say all. You can still get battery operated hearing aids. But rechargeable hearing aids are convenient, durable, and it's really the way to go these days. So you just pop it in a charger, 3 hours gives you 24 hours. Some of the hearing aids, in fact, all manufacturers should have a battery pack. So if you take off camping for a while, the battery pack will last you for a couple of days. So rechargeable is really nice. There's streaming. So that means if you hook up your hearing aid to your phone or anything Bluetooth, like for instance, if my phone were to ring right now on the hearing aids that I wear, because incidentally, I'm hearing impaired, all I do is double tap and I answer the phone call. So it doesn't matter where my phone is. I don't have to hold it. Some other hearing aids, you do have to answer the phone, but they all stream. So that's the important take-home message. There's a piece of equipment that hooks up to the TV. I thought I had one close by. It's really tiny. It hooks up to the TV and then the TV will come right through your hearing aids. So if you're watching TV with your loved one and you no longer have to have it blasting, you could literally be watching TV at night in bed at the volume at 0 and have it whatever you want in your hearing aid. So that's also a nice thing. This summer, one of the manufacturers is releasing a hearing aid that is a fit tracker. So it's gonna record your heart rate, your steps, activity, just like the Apple Watch. And they changed the design of it. So I like this design. It's not too bulky. I'm wearing it right now. You can't see, but it's fine. They're changing it to a nice little slim, funky little, a funky slim design. So all in keeping with acceptance of hearing aids. Another really interesting feature in hearing aids today, they have a sensor that can detect if you have fallen and will alert your family members. Yeah, that's pretty cool. And then one other thing, for those individuals that suffer from ringing in the ears or tinnitus and nothing else, there's a hearing aid out there that's specifically designed for ringing in the ears. I have a gentleman right now that's trying it. It plays a low level music, low level. So it's not blasting. It's just, what it does is it habituates the auditory system to forget about the ringing. So far it's working. He's 3 weeks in and his stress levels have decreased dramatically. So anything that helps is exciting for us. Okay, hearing aid fittings of the future. No longer do you need to come to an office. We can test and fit remotely. This is new. So obviously there's concerns surrounding technology. Like for instance, this is my first Zoom. That's what technology is doing. I prefer one-to-one, but the future is taking us elsewhere. So that's going to be happening. So you can get your hearing aids fixed in the comfort of your own home. Right now, you can get remote support from any clinic in BC with a hearing aid. All manufacturers have remote support. The office and the client obviously have to be willing to set that up, but that is an option. Ear impressions. Typically, if you don't get these receiver in the canals that are just fit, and ear impressions taken of your ear impressions are no longer. We scan the ear canal for perfect fits. So it's pretty cool, ear scanning. Hearing aid apps. So on your iPhone, you download an app. You can adjust the volume, you can adjust the program, you can adjust the background noise, you can adjust the speech enhancement. There's so much that you can do. So there's an app for everything. And then I was researching last night under apps and hearing help for people with hearing loss. So this popped up. I don't know about it, but I might do the free trial. It's called Ava for Health. And what it does, well, because I use closed caption watching TV all the time. I'm just so used to it. My hearing aids are working fine, but I need that extra help, right? Closed caption is a good thing, especially once you start. I mean, some people have a hard time like the reading, but it gets easier. So there's a free trial for something called Ava for Health. Okay, so on hearing aid apps, just to recap, they can test your hearing. They can find out if you've lost a hearing aid, they'll find it for you. Okay. Again, tinnitus, battery life. If you, I'll tell you how much battery life you have. Okay. Another interesting find, it's called the Hearing Hub. Now, I don't know, I'm not affiliated with any of these. It's just in my research, they offer presentations on just about anything. Some of them are chargeable, some of them are free, and there's a free tinnitus and hearing loss webinar, May 16th at 1:30. It's called thehearinghub.com. So I recommend it, actually. I checked out their website, and again, I'm really focused in my practice on prevention and education, because technology and choices are moving rapidly. So the more we know, the more we can help ourselves or our loved ones. Okay, so if you do decide to get a hearing aid, here are the questions that I want you to ask your hearing healthcare provider. You're going to talk about what kind of hearing aid is best suited for you. So that's going to be a conversation based on lifestyle, finances, all that stuff. Ask them if they have a trial period, because everyone should have a trial period. Repair, warranty information. If there's any additional costs, how often you should expect to come back for an adjustment. How long the hearing aids will last. On average, it's 5 to 7 years. And hearing aid verification. Always ask about that, because that's really important in any practice. Okay, so then, so reasons people do not get a hearing aid. And I don't know if anybody falls in this category, but I'll give you some good, well, some reasons that they cite anyway. They don't like the look of hearing aids. To be honest with you, those hearing aids look really good today. I don't know if anybody here doesn't know somebody who has a hearing aid, because they're everywhere. In addition to that, look at all the colors you can get. This is one manufacturer, and this would be a good color. It's pink. I love it, actually. But anyway, point being is you can customize the color, the shape. They look good these days. Hearing aids are difficult. That's not true. No. You can make it as easy or as difficult as you want to. So I talk about all these apps and I talk about all this stuff. The truth is, when I see a client and I counsel them, I try to make it easy because that's what I believe in. You want to put your hearing aid in and you want to just live and have the hearing aid adjust itself. So that's what my goal is when I do fittings. Cost of hearing aids, cost is legit for just about everything there is out there today. So just ask about options regarding pricing, and it's gonna, the technology, what you're paying for, all that stuff. They make me look old. So here's what I have to say to that. Struggling and asking to repeat is more problematic than anything. And my hearing's not that bad. You know what? If you have a hearing loss, you need a hearing aid. If you're struggling at all, there's help out there. Okay, now that ends the presentation. So now shoot the questions.
Well, I'll start off with a question. Great
Okay.
presentation, Lisa, so informative. Is hearing loss progressive?
It can be. So it depends what's causing your hearing loss. I mean, if it's a disease, then we can more readily predict how that's going to transpire. Hearing loss due to aging, there's no really good way to tell you how quickly it's going to change. I've been hearing impaired personally for at least 25 years. And in the last 5 years, I've noticed enough of a shift that it's problematic. Hearing loss is interesting. There's different categories. There's mild, moderate, moderately severe, severe. If you're mild and moderate, so if you catch it early, you're going to be so successful. And on that note, the earlier the better. The greater degree of hearing loss, the more challenges you have. So long and short, it can be progressive, but we don't know how quickly that can happen. You want to protect your ears always.
Thank you.
You're welcome.
You said an important thing was verification, but I don't know what that means.
Okay, so that's when I said, or we talked about a little probe tube. So what happens is you get fit with a hearing aid. And I program the hearing aid on a computer. And so I take your audiogram or your test results and I program it with manufacturer software, and it's fit for you. But then we take you over to a machine where, with the hearing aid in your ear, we measure a couple things. We actually measure the size of your ear canal and the acoustics of your ear canal, because that does make a difference with how sound is gonna flow to your eardrum. And then with the hearing aid in, there's a little probe tube that sits in your ear canal, really close to the eardrum. And then we measure soft, average, and loud sounds to make sure you're meeting target. And target is hearing within normal limits. So that's verification.
Okay, thanks.
Any other questions?
I have another one.
Okay.
So I have one of these. I got it from a drugstore. It's a little balloon that you put in water to do this, to get rid of wax. I do it twice a year. I love, but is that not wise? Or because I'm basically cleaning out the wax myself.
I'm not going to say it's not wise. I'm just going to say make sure your eardrum's intact. You don't have any holes in, because your eardrum is a membrane, and you want to make sure there's perforations or holes that can happen in the drum. So no, I'm not going to say it's not wise. My preference would be that someone else does it though, so they can see what they're looking at, because you can't see what you're looking at. You're just shooting in there in the water. I would rather you see a hearing healthcare professional.
Thank you.
If children have a lot of ear aches or even have little holes put in their ears when they're young, does that lead to scarring, which leads to problems later on?
Yes, yeah, it can. The scarring definitely changes how the membrane or eardrum will respond to sound. Because as we speak, air molecules move, and it moves the eardrum. That's how it works. Scarring impacts that. So it can contribute to loss. And sometimes not. It really depends how much trouble that child has, and how many ear infections, and how long the tubes have to go in, and there's so many factors involved. So yes, it can, and sometimes it doesn't, which is good. Any other questions?
Yeah, okay. Go ahead. Lisa,
Yes.
when can I get my appointment?
Okay, as soon as I come back next week. Yeah.
Yeah, I'm going to be booking an appointment too, Lisa.
Oh, that's good. You should have your hearing tested. All of you should at least get a baseline and then make an informed decision from that point. Hearing appointments should never be stressful, really. It's to find out where you're at, find out your options, and then you're the one who makes the decision. Yeah.
I had one other question for you, Lisa. I was just curious, how did you get interested in this area of speciality?
Oh, that's a funny question, actually. So I went to university a long time ago for speech pathology, and I was hearing impaired. And I couldn't afford two hearing aids at that time. Anyway, long story short, I went for speech pathology and I wasn't good at it. I just wasn't good at it. And audiology, I didn't even have to work at it. The marks I just got it. And it was fun. And I've been passionate about it for years. And still am. Yeah.
Yeah, it really shines through your passion.
Oh, good. Good.
Any other questions for? I don't know if I'll call you Dr. Lopez and Lisa.
Lisa. You can call me Lisa.
Okay.
Yeah.
Well, I think, did you have any, Deirdre, or any more? What about Bonnie? Do you have a question, or I can unmute you, Bonnie, if you want.
I've got a quick question, a comment, if it's okay.
Yes.
First of all, thank you so much for your presentation. And something I learned that I didn't fully appreciate before was the link, the hearing has on other aspects of our health. And trouble that you're having with your ears could mean high blood pressure and the greater likelihood that we can fall if we have ear issues. You did mention something that I've heard a lot is we shouldn't be curious, but I wonder then if you have a recommendation for what would be considered good normal ear hygiene. What would you suggest?
Actually, your ears are self-cleaning. Yeah. So are you talking simply about wax in your ears?
Yeah, just cleaning out ears, cleaning out children's ears when you see they've got wax in them, or.
So our ear canal has little hair cells that push the wax out. When you use a Q-tip, it actually pushes the wax to the bony part, which is close to the drum, and there's no hair cells there, so it's stuck. And that's when you get a wax buildup. So if people just leave their ears alone, and some people, they do have wax buildup. And also if you have hearing aids, like I said, then then you have to get it checked, right? But for the general population, just honestly, just take a cloth if you want to wipe your ear, but that suffice.
Okay, thanks.
I'd like to make a comment, Lisa. I thought it was really interesting the way you presented, because it was really down to earth for all of us to really understand what you were saying. And the information was very thorough. And I too was very surprised that an untreated ear problem could lead to dementia. And I think that's one thing that's going to make people really consider it very seriously.
Well,
Thank you so much.
I appreciate that so much. You have no idea. My first Zoom, so I wasn't sure how it was going to go. You have no idea how much I appreciate this.
I do, because we couldn't get Zoom to come on, and it turns out somehow it turned itself off. So I'm glad that we were all able to get together, and thanks again.
Thank you very much.
Thank you.
Thank you.
Okay. Bye. Okay.
Thanks.
Oh, sorry, I was on mute there. Thank you so much, Lisa. And I think we've already lost a few people, but I'll be posting this session on YouTube. And I'll also post some of those resources on our website.
Okay,
So,
perfect.
yeah.
Thank you so much.
Yeah, and thanks everybody for attending, and thanks Lisa for your time. It was a really, really enjoyable session.
Oh, good. I'm glad. Okay, everybody have a good day.
You
Bye
too.
everyone for now.
Bye-bye. Bye.